So join me as we are going to do a mini open carpal tunnel release. Now the benefits of mini open versus open are reduced scar tenderness, reduced pillar pain, early recovery to work, less wound complications. But the disadvantages are you can injure the nerve and sometimes you might skip some part of the volar carpal ligament. So let's proceed with the surgery. So here I am marking the skin incision. First a straight line along the radial border of the ring finger, and then I will mark the Kaplan's cardinal line along the ulnar border of an abducted thumb. Here we can see that the carpal's cardinal line is already drawn, and if we draw line A along the radial aspect of the ring finger, it intersects at point B, and point B is normally where the recurrent branch of the ulnar median nerve originates, and 5 to 10 mm distal to this point is our superficial palmar arch, so we have to be careful here. So our incision will be proximal to carpal's cardinal line but distal to the wrist crease. So I am giving the skin incision here proximal to the Kaplan's cardinal line. So here you will encounter some bleeding because tourniquet is not elevated. So wherever it is bleeding more, you can put your retractor there and it will stop with the pressure. Now gauze swabs rolled are very important like this. Now here this is the first layer, which is the muscle tissue. You can see red mixed with white here. I will incise it now. After incising it, we will come to the second layer, which is the facial layer, and then we will incise that too. After incising the facial layer, this is the volar carpal ligament. Now we will incise this ligament too, and then we will reach the carpal tunnel. Here you can see the median nerve and the cut end of the volar carpal ligament. Now I will first insert a curved artery forceps beneath the one end, and then cut some part of the few millimeter of the ligament with a knife so that it becomes easier to cut it with the scissors later on. Here I am using the knife. I will just cut a small part of it with the knife. Now I will come proximally, again cutting small part with the knife. Here you can see, first bring the scissor beneath the ligament, like this, and then cut it. The scissors are brought beneath the ligament to make sure there are no adhesions and we don't inadvertently injure the nerve. So slowly keep on cutting that. Here with the tip of the scissors, first feel the ligament like this and then cut it. So here ligament is almost gone, and I will cut around 5 to 10 mm of forearm fascia along with it too. Now we will proceed to the distal part. Again palpate with the tip of the scissors. and then cut it. Now the ligament is almost cut. Here you have to make sure that in the distal part there is a fat pad here. So make sure you don't go beyond that fat pad because the superficial palmar arch is there. Now this is in another patient. Here you can see that how much small the incision is. In the previous patient I used a bigger incision so that you can see. But if you are only going to see and do, then this much incision is enough for a mini open carpal tunnel release. And I hope you like the video. Kindly like, subscribe and share, and see you in next video. Thank you.